First, I'm going to demonstrate examination of the wrist and hand in the context of musculoskeletal disease. In other words, a patient who complains of pain, suspected arthritis, or other disease in their hands. I'm going to assume that I have asked this patient's consent and introduced myself in the normal way. I would ask him to place his hands on the table. You can use a cushion if you wish. I'm just going to demonstrate the examination first and then go through it again and explain. Can I just feel them now, please? And tell me if it's tender anywhere.
Sure.
Can I just turn it over that way, just that far? That's it. And then the same with this side. Can I push both your hands that way up now, please? That's fine. Okay, so now I want to test wrist movements. Okay, would you now bend your wrists up for me? Thank you, and down. Thank you, okay. And can you now twist your hands out this way and down that way? Okay. Can I now do that for you, please? And this way. And down. This way. That's it. Okay, thank you. Can I now ask you to bend your fingers down, please? And straighten them out. And your thumb, bend that in and straighten it out. Can you bend your finger out and bring them together? And lift your thumb up this way and down this way. Okay, that's grand. Thank you very much. And I'm now just going to move your fingers for you. Does that bother you?
No.
No. Okay. Right, can I ask you now to squeeze my fingers as tight as you can? Right, good. Can you push like that? Okay. And can you push like that? That's it. And move your fingers, your thumb to each finger in turn. Okay, good. Thank you very much. That all seems perfectly normal. Right, now let me go through that again, explaining exactly what I was doing and what I was looking for. May I have your hands back, please? So the first component of any musculoskeletal examination is that you look, and really do look carefully at the hands. Look for any swelling at the wrist, at the carpo-metacarpal joint of the thumb, the other joints of the thumb, and at all the finger joints. Is there swelling of the joint, or are there lumps and nodules over any of the joints? Is there any redness? Are there any rashes or skin lesions? Are there any scars suggesting that the patient may have had previous surgery? Look at the muscles in between the bones here, the dorsal interossei, for wasting. Then turn the hands part round so that you can get a really good look for swelling, deformity or lumps on the thumbs. Turn the hands over. Look for wasting again of the muscles, the thenar and hypothenar eminences. Look for swelling of the over the flexor tendons here or here. Look for Dupuytren's nodules in the palmar fascia of the hand. So we've done the look, then we do feel. Turn the hands back over and systematically palpate all the joints for swelling, synovitis, or soft tissue swelling. So start with the wrist, palpate the head of the ulna and the head of the radial styloid, and between them you can feel the joint line of the wrist, and you can detect any synovitis or tenderness of the wrist joint. Also look at the distal radio-ulnar joint for tenderness or swelling. Then systematically examine all the little joints of the fingers, and that is most easily done using your two thumbs, that you just press either side of the extensor tendon to detect synovitis of these joints. And repeat the process with the PIP and then the DIP joints. Again, turn and separately assess the joints of the thumb. Then turn the hand over and again systematically palpate the flexor tendons here, which are often affected by synovitis, and the flexor tendons here, where you may also get synovitis. A good way of detecting thickening of the flexor tendons is actually to squeeze the soft tissue over the proximal phalanx between your finger and thumb to detect swelling. Right, so first of all I'm going to test the wrist movements. So actively, would you bring your wrist back like that and down? And also I want to look for pronation and supination of the wrist. So keeps his elbows tucked in, turn your hands over that way and that way. Okay. Then do the same movements passively. So just relax and let me move it up this way as far as it will go, and down that way as far as it will go, checking for end range feel and pain. You can, if you wish, also test radial deviation and ulnar deviation. And supination and pronation. Now these of course do not take place at the wrist but at the radio-ulnar joint, but they are very important functional movements. Then I need to check finger and thumb movements. So finger movements, flex and extension, abduction and adduction of normal range. The thumb, flexion and extension is of normal range, and so is abduction and adduction. Okay? And then again, I can do those movements passively, so I can bend his fingers up, and if I push on them, that is causing him no discomfort, and I'm getting a full range of passive movements. If there's one particular joint, I can test it individually. So if he's complaining of pain, for instance, in that joint, I can actually bend it down and check that that movement is of full range. The same with the thumb. I can actually bend it passively to the end of its range and it's not uncomfortable. Then I also want to know about the functional movements of the fingers. So can he actually bend to grip? I'll squeeze my fingers tight. Give the patient 2 fingers, no more because it's uncomfortable for you, and you get a tight power grip. The other 2 functional forms of grip are a key grip, the sort of grip you use for turning a key, whether the patient can apply the thumb forcibly to the outer side of his fingers like that. Okay? And a pinch grip between the thumb and the tip of the index finger. So grip hard there and check the power of that grip. And then for manual dexterity, check whether the patient can put his thumb to the tip of each of his fingers reasonably quickly. That's it. Okay? So I have now assessed a rheumatoid or arthritic hand for function as well as palpation and movement.